So I'm here with two really close friends, and we've got Jay Allerton on the one side, and we've got Andrea Allerton on the other. And Andrea is a practitioner of Chinese medicine. We met in Chinese med school together. I wanted them to demonstrate how to use the wands, the magnet acutherapy magnet wands that are used in our practice. We both do this in our practices. And I want people to know about this because if you understand how to use them, they're so simple and they're incredibly powerful. These wands are 20,000 Gauss, which is powerful magnet. And when you direct that on a particular point with the polarity directing the flow in a very specific way, you can do the equivalent of an acupuncture treatment on yourself. This is so empowering for your health, and it's something that if you just have one, simple, easy, not expensive, there's so much you can do for yourself and your loved ones. So here you go. I'm going to give them the kit. This is what it looks like. It's very official. And Andrea is going to do this demonstrating on Jay's hand. There you go. So first she's got a golf tee, which we use because it works so well for finding a point that we're going to work on. So let's find a point. Let's find a Ren point. Yeah, that looks like Ren 8. You finding Ren 8? Mm-hmm. Okay, let's find Ren 12, which would be right in between there, yeah? So Ren 12 is a point we use often for balancing the stomach, for digestion, and she's pressing to find the most tender spot in that region. Once she finds it, and Jay can confirm, is that a tender spot, Jay?
Mm-hmm.
Yeah.
Okay,
so he goes, that's it, because you can feel it. Oh yeah, that's it. You know. Then you find it. Then you're in a place. In this case, we're going to get things moving. Let's say someone had constipation. We're going to get things moving by putting the dot side toward the skin on the magnet. Maybe you could show the dot side. So slide it up. That's the dot side, and the other side doesn't have a dot. The other side is no dot side. The dot side is going to go toward the skin, which is the equivalent of the North Pole on a battery. So it moves the chi. It directs the flow through this meridian. So this point is linking up with the meridian point Ren 12, which also correlates in the meridian system down the center front line of the body, right at the point of where the stomach is located. And I can always tell when it starts to work well because someone starts breathing differently. I just heard Jane take a really nice breath, and I always listen for that when I'm with people because, yeah, the breath tells you a lot. Ah, it's starting to move. Something's moving. So you only have to do this even for 1 minute to make a profound effect and a shift for someone. Yeah. And then you would move to another point if there's a whole series of points that we're doing. Some of the treatments we do have as few as 4 points. Some have more depending on what's needed. This is a nice grounding point that she's finding. She's looking for other tender points along the Renmai.
Or tender.
Yeah, that's tender. So that looks like, what do you think that is there? Looks like maybe Ren 4. I was looking at that too, thinking Ren 4. Ren 4 would be a point we use often.
Tonify it.
We want to tonify or nourish that point. And what will you tell people what you would use Ren 4 for? Some ideas?
Yes, we can use it on women. We can use it for any fertility challenges or fertility boost. We can use it on someone who has been feeling weak, lethargic, tired. We could use it for any urogenital issues.
Mm-hmm. We also use it for increasing vitality.
Yes.
And for men, would you ever consider that as a prostate point because of the correlation to that area of the body?
We could if they were, yes, if they're more deficient or more yang deficient. We can move on to this point for prostate.
Yeah, even
but
lower.
Then I think we would sedate it.
Because usually prostate issues are an issue of excess fire, too much heat going to that region of the body. So we'd want to sedate it or put the dot side toward the skin to help do a treatment for prostate. So Jay didn't realize we were doing such a thorough treatment on him today.
Yeah.
This gives everyone an idea of how this works. And it's so powerful.
Super simple.
So simple, so powerful. We also do a lot for pain relief. And if you turn the hand over, this side of the hand correlates more to the structural sides of conditions. So when there's a skeletal issue, and actually, yeah, here you go. She is, she's rolling the area, which represents part of the spine here. she's rolling over mid back and low back regions right now to feel for a tender spot. And when you find a spot that's extra tender, there you go. Yeah, she found one. He found one. Then that's another way that we would treat.
On the side or the top?
Yeah, it could go the top. Yeah, top is where you felt the most tender, which would be the dew line in the meridian system.
So we're going to sedate it, calm down the point because it's an excess.
Right. So if it's excess, if it's got pain syndrome, then we want to reduce the pain, disperse the chi, get things moving. So we do the dot side toward that point.
And that's how we use it.
Yep. So imagine you did that for about 1 minute. Even 1 minute is so profound, but sometimes we do 2 minutes if it's really inflamed. But in this case, 1 is even useful. Thanks, you too.
You bet.